Thank you, sir. I am presenting a time motion study on diabetes with mellitus. Okay. Hello, my name is Virginia Ebinyasi. I'm presenting a time motion study on diabetes mellitus in pregnancy with emphasis on gestational diabetes. Yeah, okay. Th- Thank you, sir. This is a brief introduction on the history of University College Hospital, where this time study motion was carried out. Yes, sir. I've started. This is an introduction, a brief introduction to the University College Hospital, where this time motion study was carried out. Here, the University College Hospital was established by an Act of Parliament in 1952. The actual essence for this was to get the medicals and let other few. Now, this particular time motion study was mainly done concerning the obstetrics and gynecology department. And there the labor word, the lining word, which is the obstetrics word, the gynecology word, and the gynecology theater. Now, the labor word is also divided into 4 stages. You have the stage 1, 2, 3, and the operating theater. The lining words are now the gynecology words are words that take care of cases like vesical vaginal fistula, rectal vaginal fistula, cancer of the cervix, and other procedures like mammectomy, salpingectomy, oophorectomy, hysterectomy, and the like. We also have the C14 words and the Southwest 4. These are specific words in charge of gynecological cases, while the earlier words mentioned labor word, West 4, West 3, they are for the obstetric cases, gynecology unit, and the assisted conception unit. Now, the lining words, they handle cases such as preeclampsia, gestational diabetes, delirium in pregnancy, elective low segment cesarean section, and spontaneous vertex delivery and the like. There are very few routine services that is being carried out in the words. These are the doctor's word round, the patient's transfer in and out from the labor ward or from other words that are adjacent to this particular place. And these are called the general word and the small word. The general word is 16 beds, while the small word is 10 beds. Now, in the general ward, we also have baby cots. We have up to 16 baby cots. Now, the main topic that diabetes mellitus. Diabetes mellitus is one of the endocrine disorders. It is the most common medical condition to affect pregnancy and occurs in approximately 4 out of 8,000 pregnancies, mostly in the United Kingdom. Carbohydrates, fats, protein. It is also characterized by increasing levels of glucose in the blood, which is hypoglycemia, and excretion of glucose in the urine, which is glucosuria, resulting from defects in insulin secretion or insulin action or both. Now, there are classical signs to be able to find out if this is in your patient. One, you have excessive taste, that's polydipsia. You have excessive urination, peripheral arterial disease, kidney diseases, loss of vision, and even nerve damage. How these affect is mainly because of the accumulation of glucose, sugar, within the blood system and the entire body system, affecting these very areas. Some patients may not necessarily come to hospital, but when they can't see, they'll come to the hospital, and when you check, they have diabetes. Now, diabetes is classified into two classes. We have the type 1, the type 2. The type 1 here there's a great defect in the beta cells in the islets of Langerhans. Most of them have been destroyed, and you can find out that it now results into the development of ketoacidosis. But the risk of developing this type of diabetes mellitus increases with age, obesity, and lack of physical activity. Gestational diabetes itself is defined as carbohydrate intolerance resulting in hyperglycemia of variable severity, which is onset or first recognition during pregnancy. Incidence. The incidence varies widely across different ethnic groups. In the Caucasians, it is 1% to 2%. In Afro-Caribbeans, it is 2% to 3%. And in Asians, you have 4% to 5%. Now, 87.5% of pregnant women have been found to have gestational diabetes. Now, what does it mean to have impaired glucose regulation? This includes impaired fasting glycemia, which are metabolic states intermediate between normal glucose homeostasis and diabetes. Now, impaired glucose tolerance is categorized as carbohydrate metabolism, resulting in slightly raised post-meal blood glucose levels which are greater than 7.8 millimole per liter. Some people are used to the milligram per deciliter, but to get that value in milligram per deciliter, you just multiply that value with 18 and you get it in milligram per deciliter. Now, the impaired fasting glucose refers to fasting glucose concentrations that are lower than those required to diagnose diabetes mellitus, but then it is higher than normal, which is the reference between a greater value of 6.1 but less than 7 millimole per liter. Individuals with impaired glucose regulation are at increased risk of developing diabetes mellitus. Now, what's the key goal? Here, it's complete care. And complete care involves proper care administered during the antenatal period, during delivery, postpartum period, and the neonatal period. The aim here is to ensure that whether at the antenatal period or during delivery or postnatal or even neonatal care, you want to ensure that these women and their babies have adequate glucose, blood glucose levels being normal throughout pregnancy, delivery, and post-delivery. That's the goal. Then we have certain neonatal complications from mothers who have gestationally at some of them, and then what were their the levels of blood glucose at the time of admission, and then what it was at discharge. Now, a nursing process record was used as an assessment format, but it's modeled according to Gordon's 11 typology. Now, the first case we're going to look at is Mrs. Kilanko. Mrs. Kilanko is rhesus negative. She's aged 33 years, admitted on the 12th of February 2015. Urine tests showed that it had 2 pluses of glucose. The gestational age at that time was 33 weeks plus 5 days. Now, she was admitted for poorly controlled diabetes. She was on a regimen of insulin of 18 international units and 1,800 kilocalories of diabetic diet. Now, the blood glucose value came up to 168 as at the time she presented at the hospital. She had admission. She had cesarean section done at the gestational age of 37 weeks plus 4 days. She was discharged with a baby on the 4th day post-operation. Now, another case is Mrs. Tanimola M. She's age 38. gestational age was 21 weeks plus 4 days, admitted on the 23rd of April 2015. She was also admitted for gestational diabetes, but hers was controlled just with diet. And the blood glucose highest values was between 147 milligrams per deciliter and 162 milligrams per deciliter. Now that's to tell you that age plays a role when it comes to this particular disease. The older the person gets, most times it becomes worse. Now, with good diet regimen, the glucose value dropped to 85 milligrams per deciliter. She was discharged with 2 weeks appointment. Case 3 is Mrs. Bennett. She was admitted at age 30 years on the 27th of April 2015. The gestational age at that time was 38 weeks plus 3 days. The blood glucose came up to 133 milligrams per deciliter. For Mrs. Bernard, it had to be controlled with subcutaneous insulin of 6 international units and 1,800 kilocalories of diabetic fat.
Miss Virginia, sorry for the interruption.
She had glucose
Hello,
control
Miss Virginia.
well
Miss Virginia,
properly
sorry for the
done,
interruption.
and it came down as low as 88
Virginia,
milligrams per deciliter.
sorry for the interruption.
This patient had to undergo cesarean section. By the time her
Hello,
baby was born, her baby was hypoglycemic,
Virginia.
and this necessitated that the baby had to commence artificial feeding. She was discharged with 2 weeks appointment. Then Mrs. Oladosu